With that said, our last speaker of the day is Elaine Furst. Elaine Furst has been a registered nurse and a nurse educator. She received her nursing bachelor's from Alfred University in New York State, a master's in liberal arts from Johns Hopkins University, and a master's in mental health nursing and administration from the University of Iowa. She's currently working as a background actor in movies and TV and travels with her husband Dan, who you just saw in the presentation before this one, around the world to his speaking engagements as well as giving lectures herself. She also reads weekly to children in Los Angeles and Egypt over Zoom. She is a past chair of the board of the Scleroderma Foundation, having joined one of the two original organizations, the United Scleroderma Foundation, in 1994 in Seattle. Learning from people with scleroderma and making use of her teaching and nursing background, she has led support groups for people affected by scleroderma and has given many workshops and lectures on how scleroderma affects people, both patients and their supporters, including support group leaders. Please join me in welcoming our friend, Elaine Furst.
It is a pleasure, Christina, and I thank you so much. I joined Dan in thanking you for inviting us again to Cheri Wu's Education Day, and we're so glad that it continues. So, I have to share my thing here, share my screen. Well, thank you very much. And I'm so glad that those of you that stayed, because I know that this is a difficult subject, but it's also something that is quite important. And so we're going to start with some things for you to think about. Since we have about 100 people here, I can't ask all of you to respond to this, but I want you to think about what it is you hope to learn today. And if there's anything that you would like to tell me, then would you put it in the chat, and Christina will tell it to me. I might be able to get to it as well. We are brought up not to talk about, in polite company, politics, money, and sex. Right? We're not supposed to let on any of other people into our family issues, and sexuality is one of them. So we've been kind of brought up and told not to talk about this except in hushed tones. And so it's very difficult for some of us to talk about it. I do need to tell you that I will be using anatomic and scientific language today. So I will call a penis, and a vagina, because otherwise we get into murky territory. The coverage of the subject is inadequate because most everyone is uncomfortable, and that includes a lot of physicians. Not that they're not interested in how you're doing socially, sexually, or otherwise, because that does have an impact on your health, and the health has an impact on it. But I'm not sure many of them have been schooled to deal with the problems that come up. So very often doctors don't ask about that. I know Dan does, because it's something that he feels strongly about is having an effect on somebody's life. So here's what we're going to do today. We're going to start out talking about the difference between sexuality and sensuality, and to talk about the importance of both of these to people in general and to especially people affected by scleroderma, which involves everybody who cares about you. So that means even though your family might not have scleroderma, they are interested in how your scleroderma is affecting you, and then it affects them as well. Discuss facts about sex and scleroderma from a physical and an emotional point of view. And I asked Christina about pregnancy. Since most people who have scleroderma are over 40, at least statistically, she thought that it would be helpful to some folks to talk about pregnancy, so I will do that. And then we're going to talk about some ways to cope with sexuality and your scleroderma together. I'm hoping that those of you with partners, those of you who are here today, I hope that you can show this to your partner so that this other person can reap the benefits of having this discussion, and that you guys can talk about it together. And then we're going to talk about some resources, which I found a bunch of for you. So first, we're going to define sexuality and sensuality. Sexuality is concerned with biological, psychological, sociological, spiritual variables of life that affect personality development and interpersonal relationships. That's sexuality. It includes physical intimacy, such as intercourse, as well as self-image, self-esteem, what you think of your body, and your own concepts of love. Sexuality is, this is another way to put it. Sexuality is expressed in the way we speak, smile, stand, sit, dress, dance, laugh, and cry. It's an integral part of who we are and what we believe and what we feel and how we respond to other people. So sensuality relates to the body and the five senses as distinguished from the intellect or spirit. Bodily or sensory pleasure, that's through your eyes, your ears, your nose, your mouth, but not necessarily sexual. So some sensual experiences you can think of. If we were in a room together, I would be asking you this. But this is what some people have told me are examples of sensual experiences that people have listed. And I think these are things that we can all agree are sensual. I'm thinking also of sleeping on very soft comforters or sheepskin, reading or having other people read to you. Perhaps over the pandemic time, you have discovered some other kind of sensual experiences that have been very helpful to you while things have been kind of running amok over the last year and a half. So why are they important? Why am I even talking about them? Well, basically, having pleasurable experiences of all and any kind increases your quality of life. I'm thinking about children that are raised in orphanages where no one touches them, and they never get a chance to run in the grass, or thinking about shelter puppies, or thinking about us not being able to be hugged if we're living alone is a very hard thing. If we can't create pleasurable experiences within quarantine, it affects our quality of life. And sexual experiences comes along with that as well. But I'm talking about good sexual experiences. And so that's the thing that underlies everything we're talking about today, is that these are helpful, good, nice sexual experiences, not something that's going to hurt you. So that increases your self-esteem, feeling of well-being, feeling of being a desirable person. People have reported their pain has decreased, their optimism has increased, an increase in satisfaction with the relationship that you have. And there's research involved with this. There is a bunch of research on hormones. The dopamine, which is a brain hormone, increases during pleasurable sex or pleasurable experiences of all kinds. Things like exercise, where you feel really energized at the end of it, not where you're gasping in pain, increases people's feeling of optimism and increases that dopamine. Sex helps the immune system ward off germs, viruses, and other intruders from outside the body. There has been difficult experiments about this. It's always harder to do experiments with the psychosocial aspect of our lives. But they have discovered that people who have a good sex life don't get sick as often. I suspect that optimism has something to do with that, and people being optimistic are people who tend to go at life with a positive attitude and who are willing to try new things and who look at things that are difficult as, what can I do about that? So your libido is boosted as well. That is the urge to have sex. And they found that if you have sex, you want more sex. If you have good sex, you want more good sex. Libido also means appreciation for beauty, appreciation for having happy experiences. It can improve, good sex can improve women's bladder control as long as it isn't rough. Helps to lower your blood pressure, which might be a problem if you have scleroderma and already have low blood pressure. So be careful of that. And it also counts as exercise. So it's like 5 calories a minute, 60 minutes in an hour. So if you can go for an hour, you've gone 300 calories. Of course, going to the gym regularly, like going to the gym regularly, if you are consistent in your sexual behavior, you can maximize the benefits. It can lower heart attack risks, keeps the estrogen and the testosterone in balance, and these help the heart to stay healthy, along with other things. It lessens pain. Orgasm and self-stimulation releases hormones that help raise the pain threshold, and that's the dopamine aspect. It can make prostate cancer less likely, although the study isn't completely conclusive. They found that men who self-stimulate and masturbate 21 times a month tend to get less prostate cancer. Improves sleep and eases stress. So there's a lot to be said for having a good sex life. Let's talk about sex and scleroderma. This is the list of things that you all go through. Some of you have more of one of these things than others, but this is what you guys have to deal with. And I'm sorry about that. Any one of these is not fun. So, who feels sexy when you're in pain? Who feels sexy when your skin is tight and your fingers hurt and your joints hurt? Who feels sexy when you're not sure that you're attractive anymore, which is part of the body changes that you have all gone through one way or the other. Since the average age of women with scleroderma is within the menopause range, some of the symptoms are the same. And so you've got a double whammy there, caused by autoimmune problems, not spiking hormones. So I made a comparison. And maybe you guys hadn't thought of this, But those of you that are over 40 into your 50s might be experiencing the menopause aspect of these symptoms at the same time that you may be experiencing all these things in terms of your scleroderma. That's why we all talk about people with scleroderma as being warriors, because this is what you have to fight all the time. Then you are taking some or all of these medications, and you can see on the left side the names of the medications, and on the right side these are the sexual related issues that some of these will cause. A lot of impaired lubrication and impaired arousal, impaired desire and libido. So this is what you have to contend with, as my mother used to say. So it shows the side effects, and although these side effects might get in the way, there may be substitute medications, so talk to your docs about them. If they don't open up the subject, you might have to open up the subject. In fact, you might definitely have to open up the subject. Talk to them and see whether or not there are other kinds of medications that you could have instead of the ones that are giving you the biggest trouble. I know that you do a medication review with them. So put this on your list of one of the things that you need to talk about. So here is the triangle of annoyance that you have to deal with. Scleroderma often increases your depression, fatigue, pain, and then you've got age getting in there with the hormone levels, leading to decreased libido and possible sexual adjustment problems, which could mean no sex, painful sex, unsatisfying sex, your partner's being afraid of hurting you, difficulty talking about these kinds of issues with each other, which is why I want to open this thing up and why we started talking about this about 10 years ago to begin with. So this is the triangle of nastiness about this problem. Now you can change the bottom level to just plain menopause, because menopause itself causes all this stuff. Fatigue and hot flashes and the other aspects of aging. So, not to mention some other diseases also do this, especially the ones that cause you pain. Okay, so what about pregnancy? And if you have any questions, be sure to write them so I can talk about them later. There's some good news about pregnancy. You can see that 71%, and this hasn't changed since 2006, 71% of pregnancies end up in live births, 24% miscarriages, and 5% babies who die. This is what the general population has as of the CBC in 2014. 63% live births, 16% miscarriages, and 6% infant deaths. So we're doing a little bit better for the live births. I suspect that's because we have specialized care for scleroderma patients, because it's considered to be a high-risk area, and you need to have a bunch of really good docs collaborating together. Now, what happens with the pregnancy and scleroderma? And this is only 34 people, patients, women, and it was in 1996. And I would venture to say there isn't a whole lot of research that's being done on this right now. But my husband tells me that that hasn't changed either. After the birth, 61% of the patients were stable with their scleroderma. 20% improved. I'm sorry, this is in pregnancy. 20% of the patients improved during pregnancy. This happens with with rheumatoid arthritis patients as well. It's a protective mechanism of the body, and people feel better when they're pregnant, at least at the beginning. 20%, however, did get worse. 4% were worse at postpartum, and 3.5% had postpartum renal crisis. I'm not sure, but I'm thinking that probably had to do with preeclampsia, which is high blood pressure of pregnancy. So the good news is the patients do well during and after pregnancy, but there's a big but here. The patient has limited disease that is under control. The medications that they're taking, such as Cytoxan and methotrexate and others, are stopped before conception. So if you're going to try and have a baby, you better be talking with your rheumatologist about stopping Cytoxan and methotrexate and a few others. Your OB and your rheumatologist should be collaborating. The pregnant person takes good care of yourself, and she has lots of support and actual help once the baby is born, as the scleroderma may flare after birth. But the baby is usually born healthy, and no breastfeeding is allowed if the medications are resumed. And here's the bad news. Patients with systemic scleroderma have more difficulty getting pregnant and coming to term. The third trimester, you need to be monitored almost weekly because of the danger of hypertension, renal failure, and so forth. Remember that 3.5% did have some renal issues. The GI tract is under stress in every pregnancy. So GERD and constipation, diarrhea could increase, and you need to be paying attention to that. If there's any evidence of pulmonary, cardiac, or kidney problems during the pregnancy, the termination may have to be considered for your own health. I made a list from rheumatology.org, which is the American College of Rheumatology website, which I hope you have accessed. They have some very interesting fact sheets, and this was a list of medications to avoid or that you can continue to take. And so you might want to keep this if you're going to be pregnant, want to be pregnant, are pregnant. Congratulations. And like menopause, I made up a slide so that you could see all of the symptoms in your systems for scleroderma that might also react with your symptoms for pregnancy. It seems to really be helpful that people know what to expect so that they're not scared when and if these things happen. And most of you, I hope, have been told that if your blood pressure goes very high very quickly, that you need to be in an emergency room so that your high blood pressure can be treated before your kidneys start to fail. And this is something that happens with some patients anyway during pregnancy, whether they have scleroderma or not. So that's something to really pay attention to. Okay. We have to look at what sexual success means. And that depends on you and your partner. But primarily it depends on you, because you need to communicate to your partner what your definition of being fulfilled sexually is. Does your partner know what it is? Is it okay with you if you don't have an orgasm? Or is that your definition of sexual fulfillment? What is your partner's definition of sexual fulfillment? How was your sexual satisfaction pre-scleroderma? Could it have been better? In what way? How well have you accommodated to scleroderma? If you have found all the tricks or many of the tricks and used them and you're feeling pretty healthy, you know what to do in case there's a problem, you have good medical care, you have been through a few crises and come out the other side with more knowledge. These are the kinds of skills that you can use to improve your sexual health. Reading, educating. One of the doctors, one of the rheumatologists we know says a lot to us that his scleroderma patients and all of the other ones that he's met at conference and so forth are some of the most educated about their disease that he has in his whole practice. So use those skills to improve your own sexual health. What is the state of your communication with your partner about anything, but about uncomfortable subjects? Is it good? Could it be better? Has it never been good? If it's never been good, it should get better. And maybe you shouldn't expect things to change until you guys talk a lot more. Okay. So this slide talks about what is the sexiest part of the human body before we get into the nitty-gritty of how you can have good sexual activity. Well, usually people get this, the answer to this, and it is, of course, the mind. I will, whenever I do this slide, I always think of some paraplegics that I was part of taking care of, and they had orgasms. Now, if these guys who were young and basically healthy, who had motorcycle accidents and had their spinal cords badly injured and were in wheelchairs and had to catheterize themselves in order to go to the bathroom, if they could have orgasms, why can't you? But the sexiest part of the human body is the mind, because it helps us to change our behavior, to think differently, to have different attitudes, and to see ourselves differently. So, attitude counts. If you and your partner are talking about having sex, you might start with some thoughts, some pictures, some ideas, some sensual activities together. Have intimacy for intimacy's sake. I know it's been really hard to get out and do things recently, especially since the weather's been bad, as well as we're having pandemics everywhere. But going for walks on beaches are still allowed in most places. There are things that you guys may have done in the past that you've kind of let go, do it again. Get some flowers, make some nice dinners, get dressed up to go out and go for a walk. Use helpful devices for sex just as you use devices to help you in the kitchen, at work, and so forth. And there's some resources that I can show you where to get those if you want. Take your medicine, because this is going to be a physical activity. You don't want to have pain. You don't want to have GERD interrupt. You don't want to have a flare up and try and have a good sexual experience while you're hurting. So make sure you take your medicine. Like we talked about, having scleroderma very often means a dry vagina. So these are some very nice moisturizers for your vagina and your external labia. Don't tell anybody I said this, but I recommend YES. YES.com is a website. They are out of Ireland, and they will send you these wonderful things that are so lubricating and very, very organic, totally organic. The others are not as, but Luvina is not bad. KY jelly works. Some people need Premarin, which has some hormones in it. And you might want to talk to your doc or your GYN about that. Or you can use both, Premarin plus moisturizer. Take a warm bath, give and get a massage, if you can do that. Oils, make up the bed with clean sheets, use music. There are lots of ways that you can set the scene. You can also stretch the vagina for a period of time with progressively larger dildos and lots of moisturizer. This is from Rancho Los Amigos, which is a very active rehab center for arthritis and spinal cord injuries and so forth. And if you want to try that, sometimes that's just experimenting, which can be fun. Some people don't bend this way, but people can. And you can find your own ways of doing things. Communicating is very important in these situations. There are more ways to pleasure yourself and your partner. You can use pillows. If your mouth doesn't stretch, use your tongue for oral sex. Your partner can sit on a chair while you kneel down, if you can do that. Masturbating is recommended. Women are not taught as much about masturbation as men are. So you need to have your lubricating jelly available. Handheld shower heads are good, long-handled vibrators. And mutual masturbation, using comfortable positions for both of you, using the lubricating compounds, communicating to your partner the best places to touch and how hard or soft. If you guys have never done that, it's a good place to start, actually. And here are some curated resources. So I am now the LA County Museum, and I've curated these resources for you. I looked up mypleasure.com, and this is, I looked it up and wandered through it and have not been contacted by them. Sometimes when you get onto sexuality websites, even if they are perfectly legit, they send out ads and do all of that kind of stuff. I have gotten nothing back from them, and that was very comforting to me, because I know people don't like to go on these things for fear of being contacted or attacked or whatnot. So this was created by Dr. Gardos. He's a research scientist in New York at the HIV Center for Clinical and Behavioral Studies. And it's a site for various toys that can make sexual activity easier, and there's education involved as well. There is also a blog where you can learn a lot of things, including about male impotence and so forth. The education might be a bit of an adventure for some people, but I guess that's one of the reasons we still have 83 people. So I suggest that maybe you might want to go on that alone or together. SIECUS, S-I-E-C-U-S, stands for Sexual Information and Education, something or other of the US. And it is a nonprofit, been around for a really long time, and they know their stuff. So it's very educational what they have to say. Rheumatology.org is the ACR. And I looked them up for the fact sheets on pregnancy. Ann Jackson told me about Sex for One a long time ago. Thank you, Ann. And there are pamphlets from Planned Parenthood and several other organizations that you might want to look up. The Arthritis Association has relationship and intimacy information. They also look at family planning, scleroderma and pregnancy, that you might want to look up if you're wanting to get pregnant or are pregnant. They also have articles on keeping your marriage strong through adversity. And I do believe that they talk about sexuality as well. So I'm about to wrap this up. I really miss the interaction with all of you. I've given this lecture several times, and I always learn something from the audience. So I'm hoping that there are some questions. I don't quite know how to do this, but maybe you can just think about it and talk to your partner about this, that you can think about one thing you learned today that you didn't know. I would imagine being as experienced a group as you are, that you know quite a lot. And but maybe there's something that came up that you didn't know. These are private questions. I think these are things that it can help you function much better sexually if you talk to your partner about it, if you have one, and I hope you do. Name one thing you learned today that you think will help you function better sexually. And write down on a piece of paper one thing that turns you on when making love. And then your homework is to write the answers to the private question and share the answers with your partner. It's amazing what we don't share with each other. Because I go back to the very first slide saying that we aren't taught how to share these kinds of things. In fact, we're taught not to. So grab a balloon and say hello to my grandsons and their dog. And thank you very much for being here. I so appreciate it. Next year, come the hugs.
Someone
Okay.
asked what I was looking the most forward to when this is all over, and that's exactly what I said. I said hugs.
Yeah.
I need hugs from other people. Like I love my husband and I love his hugs, but like I need to hug somebody else.
Yeah, absolutely.
We do have a bunch of questions in the chat.
Oh, good.
Can you see the chat? If you stop sharing your screen, I think it's a little bit easier.
Participants. Chat, got it. Okay, let me go up to the top. All right, I see a lot of thank yous. Okay. Does scleroderma affect fertility? That's a question, Dan. Nope. He says no. But you have to stop taking those medicines beforehand.
It does affect pregnancy. Smaller pregnancies.
Oh, yes, it affects the pregnancy the way we talked about on the slide. Smaller babies, maybe hypertension issues, and so on and so forth. But people who want to get pregnant generally can get pregnant, but they have to watch out for those medications, and they have to be prepared to be really, really careful during pregnancy. Thanks, Steve. I'm trying to figure out if my issues, are scleroderma related. I no longer seem to be able to expand enough to accommodate sex with the same husband who I used to not have issues with. Is this a known scleroderma issue? I'm 52, but not yet in menopause. You also have endometriosis. Oh my God. I'm hoping you're being treated for that. And the FSH doesn't go down slowly. I mean, it doesn't go down on a slide. It goes down up and down. So the day you had your FSH taken, maybe you had that amount of hormone going for you, but maybe the next day or the day after or the week after, it slid again. Not to mention the fact you're getting older, and I don't know if you've tried any kind of lubrication together with looking at your medications with your doctor. You might want to do that.
Dilation.
What?
Dilation.
Yeah, and Dan is mentioning dilation, which can be done with fingers. And if you've had no trouble accommodating your husband before, maybe he can help you with dilation during during the pre-sex.
Elaine, I'm sorry, this is the person who wrote the question. I will add that for the last month, I've been seeing a pelvic floor therapist and trying to use dilators. We've had limited expansion, but not enough so far. I'm hopeful, but I'm not confident. So I just wondered if this is common.
I don't know how common it is.
It's common.
Dan says it's common. I think keep it up, Cheri, and both of you need to be working on it together. For the time being, until something either works or doesn't work, the two of you can be working on fingering, mutual masturbation, and so forth. And penetration does not always necessarily mean that you haven't had a successful sexual relationship. So you need to look at your definitions of what's successful and talk about it. And it may not last, this may not last forever. Think about that in that way. What do you think?
Can I say something?
I'm not hearing anything.
May I say something?
I'm sorry, did you want me to respond?
Well, I just wanted to know whether or not that resonated at all.
Yeah, it's just gotten worse over the years, and I've finally just been very outspoken to my OB.
Absolutely.
I'm trying vaginal estrogen, multiple things. I'm not sure if menopause, what it is, but it's really been about 2 years that I've been in significant pain. So,
yeah. Okay, Dan wants to say something.
Yeah, this is a problem that I see, not frequently, but I see it. And there are no good data about this, but if one thinks about fibrosis and scleroderma, the answer is not dilatations periodically, but literally leaving the dildo in, which stretches the vagina for periods of time. If one does a analogy to fingers, one wants to decrease the contractures in the fingers, you have to stretch the fingers for at least 6 hours at a time. And so a dilation, which is, you can feel it, but it doesn't hurt, might be the thing to do at night when you're asleep, so that over time you'll get increased stretching that way. This is not data derived, but does make sense in terms of fibrosis per se. So I'll get out of the way.
Oh no, stay. We could hold hands, Dan. Yeah, I have a lot of questions about menopause. Whoa. Okay. So I think the person that wrote about the vagina becoming very hard a couple of times and calmed down, I think that may be the same kind of question. And I'm hoping that you also can work with your GYN or your OB, whichever, to get some medication in there and some dildos possibly. Somebody asked if scleroderma can accelerate menopause. And my doctor here says no.
Except medications, of course.
Well, yeah, we need to look also at medications. It's really important, especially since all of you have a very complicated disease. This is a multi-system disease. So it's really important for you and your doctor to go over medications on a regular basis. Not every time necessarily, but on a regular basis, so that these kinds of issues can come up. Somebody mentioned that there's an organic lubricant called Love LOVE, that it's really good. What is HELP syndrome? HELLP? What is that? Did somebody tell me? No. Another question. Does Actemra need to be stopped before getting pregnant? Is that a yes? He's thinking.
As far as I know, there aren't good data, but in one registry of which I'm aware, it did not increase, not decrease pregnancy.
In one registry that he's aware of, it did not decrease getting pregnant. It wasn't dangerous to the baby or the mom.
It did not appear to be.
Did not appear to be a problem for the baby or the mom.
In animal studies, it did not appear to be a problem, but it's not definite.
Not definite right now because they've tried it in animal studies and that was not a problem, but they're animals, so. So some people are saying that dildos and lubrication hadn't helped her, but for some people it does. So keep trying, keep working on it. It's worth it.
The prolonged stretching is
Yeah.
important.
Dan says the prolonged stretching is important. Any recommendations for combating the extreme fatigue? How do you have sexual relationship when you're so tired?
That's a whole different lecture.
Yeah, that is a whole different lecture. Dan does a whole deal on fatigue. And you need to look at medications and maybe change some of those. You need to be getting enough good sleep. You need to be assessed possibly for sleep apnea, depression, disease activity, because you know when you're in a flare, that also affects your sleep. So look at those things as well as whether or not you're going to be able to have sex. And I'm hoping that you can really talk about this with your partner so that he or she knows that it's not them, that it's the damn scleroderma. Oh, HELP syndrome, complication of pregnancy characterized by hemolysis, which is blood breakdown, elevated liver enzymes, and a low platelet count. Do you know about that?
Yes, I do. So what is the question?
So the question about HELP, is it possibly linked to scleroderma? Because this woman had it when she was pregnant.
It is not, but it is potentially an autoimmune illness.
It's not directly associated with scleroderma, but it is an autoimmune, possibly an autoimmune disease. How does skin and or scarring tissue around the groin, or what about scleroderma actually affects a man's penis erection?
Two things. The blood vessels may become narrowed, and there may be fibrosis or scarring in the tissue.
Could you hear that? Did you hear that, Christina? Yeah.
Yes. Yeah, we can hear him.
Okay. Yeah. He's trying to be quiet so that he doesn't impinge on whatever it is I'm doing over here. Because he's a nice guy. This is interesting. Any concerns with taking hormones typically given to help menopause symptoms such as progesterone, estrogen, while taking scleroderma meds?
Yes. I'm going to have to speak up on this one. One, the hormones can affect the liver enzymes that metabolize some of the drugs you use. So you need to check with your rheumatologist on this for drug interactions. Two, the hormones themselves have significant potential side effects, including uterine cancers and clotting and breast lesions, and that has to be paid attention to as well. So they're very important for people, but as I said in my lecture, you never get something for nothing. So look for drug interactions and potential side effects of the drugs themselves.
Question about anything new for men with ED problems.
You want to answer that?
Yeah, I don't answer that.
Okay. So the answer basically is no, but there is a fair amount that can be done for erection problems, not so much for climax problems. There are both hormonal treatments, vascular treatments, and penile insertions, which can be put in so that with literally pumping, the person can get an erection that will be very effective if they need it.
Did that answer the question? Okay.
Pretty much out of time.
Okay. All right. Well, welcome from Wyoming, Teresa. And I know that the Oregon group is a wonderful group, so I'm glad you found them.
I'll turn it over to you.
And now I'm going to turn it back over to the Prez.
Thank you so much, Elaine. We really, really appreciate you coming out and doing this on Saturday, both of you.
Oh, not a problem. What were we going to do anyway?
Right?
Right?
We're all stuck
We're
inside
here.
anyway.
Yeah,
Might as well make the best of it.
absolutely. That's we're getting real good at that, right?
I feel like
Adaptation.
Well, thank you so much. And thank you to everyone who attended our 20th annual Cheri Wu Scleroderma Education Seminar. Like, what a day. I hope you all learned a whole lot today. And if you enjoyed today's presentations, please consider making a donation to the Scleroderma Foundation Oregon chapter at scleroderma.org/Oregon. We would really, really appreciate that.